2025 is racing by, and the envelope that decides your health care for next year is about to land in the mailbox. It's the Annual Notice of Change, ANOC, and it isn't junk. Medicare Advantage and Part D plans reset on December 31st. On January 1st, a new rulebook takes over. The card may look the same and your doctor may be the same, but copays, deductibles, drug tiers, networks, and prior authorizations can all change. That's how people get hit with January bills they never planned for. Here's the trap. People assume no news is good news. It isn't. Insurers swing between growth and margin mode. In growth, extras expand. In margin, benefits tighten. PPO choices shrink, and plans exit counties. If your plan is ending, the ANOC says it. Ignore it, and on December 31st, your plan disappears. You fall back to original Medicare, 80% paid by the government, 20% on you with no cap. A $50,000 knee replacement on January 2nd becomes a $10,000 out-of-pocket punch. Timing is your hidden weapon. NOC letters usually arrive mid-September, often the third week. 2026 plan details surface around October 1st. The time to switch is the Annual Enrollment Period, October 15th through December 7th. Miss it and your change may not start until February 1st. When the ANOC arrives, build your 3 Ps. First, providers. Who treats you now and who do you want next year? Second, prescriptions, exact drug names and dosages, plus your preferred pharmacy, chain or local. Third, priorities, moving, travel, a new grandbaby across state lines, anything that changes how you use care. Now the fork in the road. Original Medicare with a Medigap policy versus Medicare Advantage. Medigap letters G, N, and the older F are standardized by federal law. A Plan G is a Plan G no matter the insurer. Hospital and medical benefits are identical. What varies is price now and how it rises. Don't just compare this year's premium. Think long-term and consider the carrier's financial strength and whether the policy is community-rated or attained age. With Medigap plus Original Medicare, the standard is medical necessity set by your doctor, not a plan's internal rulebook. Medicare Advantage is different. A private replacement for Original Medicare. Networks matter and prior authorization is common. HMOS, lock care in-network except emergencies. PPOs allow out-of-network only if the provider accepts the plan's terms. Otherwise, you can be billed 100% at the counter. When carriers move to margin mode, PPOs are often first to shrink or vanish because they cost more to run. Drug coverage is where quiet losses pile up. Simple rule: commit to your Medigap. Speed date your drug plan. Reshop Part D every fall. Formularies and pharmacy deals change and can swing costs by hundreds. For 2025, the Part D out-of-pocket cap is $2,000. For 2026, it's $2,100. If a discount card like GoodRx beats your plan price on a fill, use it. Just know those purchases won't count toward your Part D spending. If you take multiple meds and expect to hit the cap, off-plan fills can slow you down. Penalties are the other trap. Skip Part D for more than 63 days without creditable coverage, and you owe a lifetime penalty equal to 1% of the national average Part D premium for each month. You delayed. Roughly 35 to 45 cents per month per missed month, charged forever as long as you have Part D. Skip Part B without creditable employer coverage, and you rack a 10% penalty for each full 12-month period you waited, also for life. Employers must issue a letter each fall confirming whether drug coverage is creditable and keep it on file for 10 years. Hard truth: long-term care, bathing, dressing, eating help, the 24/7 support many people assume Medicare covers isn't covered by Original Medicare, so Medigap won't pay for it either. Many families lean on Medicaid for nursing homes. But with talk of cutting roughly $1 trillion from Medicaid over a decade, states will be pushed to tighten or tax. When budgets shrink, eligibility gets tougher and wait lists grow. Reading your ANOC isn't busy work, it's defense. If the $185 monthly Part B premium is cracking your budget, look at Medicare savings programs, QMB, SLMB, QI, through your state. If approved, the state can pay the Part B premium and sometimes cost sharing. The process can feel like bureaucratic ping pong. Stay stubborn, appeal, document. A fix meant to streamline this was delayed close to a decade. Until that changes, persistence is policy. Veterans have pivots. TRICARE for life, typically for military retirees, functions like a zero Medigap when paired with Part B. It covers the 20% and includes drug coverage. VA prescription coverage is creditable for Part D, so you can rely on it without a penalty. But VA medical care isn't creditable for Part B, so don't decline Part B if you want the option to see non-VA doctors or if you might move away from VA facilities. Part B Give Back. Advantage plans exist in select counties but have been shrinking as carriers chase margins. Under 65 and on disability, Medigap access is a state-by-state fight. Roughly half the states require insurers to offer at least one Medigap to disabled beneficiaries, often at high premiums with limited letters. In the others, you may need Advantage until 65, when a 6-month Medigap open enrollment window opens with no health questions. Wherever you are, guard your guaranteed issue lifelines. If your Advantage plan terminates December 31st, you can buy a Medigap with no underwriting. 4 states, New York, Connecticut, Massachusetts, Maine, offer broader paths from Advantage to Medigap without medical questions. The other 46 mostly give one golden window. The first 6 months after you start Part B. What if you wake up on January 3rd and realize your plan ended? From January 1st to March 31st, there's a Medicare Advantage open enrollment period, but it's a second chance only for people already on Advantage. If you slid back to original Medicare because your plan exited and you made no new selection, you'll need a special election to move. And even when you enroll, timing matters. A change made in January may start February 1st. Any January hospital stay? Original Medicare covers 80%. You own the 20% with no ceiling. 2 more pressure points. First, the Part B premium and Social Security COLA. Most people pay $185 per month for Part B this year. Next year's number usually drops in early October. Forecasts have floated $195 or even $212, but speculation isn't a bill. Second, HSAs. If you're on a high-deductible employer plan and want to keep contributing, do not start any part of Medicare yet. You can still use existing HSA dollars for many Medicare expenses, not Medigap premiums, but contributions must stop once any part of Medicare starts. So here's the playbook. Open the ANOC the week it arrives. Build your 3 Ps. If your plan ends, use guaranteed issue rights to grab Medigap without health questions. Reshop Part D every fall. Pennies and tears matter. Apply for QMB/SLMB/QI if the Part B premium is crushing you. Veterans, keep Part B for choice. Pair TRICARE for life correctly. Rely on VA drug coverage as creditable. And don't join the last-minute crowd. Aim to decide before Thanksgiving so January isn't a financial ambush. This system isn't friendly, it's navigable. Information is leverage. Timelines are leverage, letters are leverage. Use all 3 and keep what's yours. If this helped, subscribe, like, and drop a comment with your biggest Medicare question or your zip code and situation, so the next deep dive hits what you need. And here's the cliffhanger. If a quiet prior authorization pilot under Original Medicare expands in 2026, does Doctor Decides give way to Insurer Decides even outside Advantage? And if that line moves, Who wins, who pays, and who's ready when the rules shift overnight.